There was a night I sat in the call room and Googled jobs outside medicine. I wasn't looking out of curiosity. I was desperate, tired, and honestly done. I had only been working for 3 years when I started to feel it. Not just tiredness, but a deep, creeping numbness. I was still seeing patients, still taking calls, still smiling at rounds, but inside, I felt completely empty. I'd go days without really tasting food. I'd forget conversations as soon as they ended. I began to flinch when my phone rang. I dreaded every night call, not because of emergencies, but because I didn't think I had anything left to give. That's when I realized I wasn't just tired. I was burned out. There was one night that changed everything. A middle-aged woman had come in, chest pain, history of diabetes and hypertension. We started her on oxygen, ran the ECG, got labs. I was doing all the right things clinically. But she looked at me and said, "Are you okay?" I blinked. "You look like you haven't slept in weeks," she added. It hit me hard that even patients could see it, see the exhaustion bleeding through. Later that night, after we stabilized her, I went to the call room and cried. Not because anything went wrong, but because I had nothing left in me. That night, I actually Googled how to quit medicine without disappointing everyone. If you're a doctor watching this and you felt this way, let me tell you, you're not alone. Burnout is real, and it's not just fatigue. It's emotional exhaustion, depersonalization, and a lost sense of purpose. Research shows that over 50% of physicians report symptoms of burnout. For many, it's tied to long hours, lack of autonomy, emotional strain, and a culture that sometimes punishes vulnerability. The danger isn't just to our well-being, but to our patients. A burned-out doctor misses things. A burned-out doctor loses compassion. That's not the kind of care any of us want to give. So what changed for me? A few small but powerful shifts. I started by setting boundaries, saying no to extra shifts I didn't need, taking breaks, even short ones, without guilt. I began journaling after each shift. Not everything, just one patient I connected with. One small win. That helped remind me why I chose this path. And most importantly, I started talking to others. I found a group of colleagues who felt the same. We created an informal check-in system. We text, vent, support each other. That made all the difference. If you're struggling right now, here's what helped me. Name it. Burnout thrives in silence. Rest, not just sleep. Active recovery like time in nature, creative hobbies, quiet reflection. Talk to someone, a colleague, therapist, mentor. Speaking helps lighten the weight. Redefine success. You don't have to save everyone. Just be present. Reconnect with impact. Remind yourself of the lives you've touched. Talking to someone helps lighten the weight, even if it starts with a few online sessions. I eventually signed up for a structured, therapist-guided program that I could access anytime, even between calls. It wasn't an ad, just a real lifeline when burnout hit. If you want to explore something like that, I've added the link in the description. I'm still a doctor, still on call, still get tired, but I'm not empty anymore. Because I learned that healing isn't just something we give, it's something we must receive, too. If this story resonated with you, you're not alone. And if you have your own experience to share, send it to us at clinicconfessions@gmail.com. Medicine may break us sometimes, but it also gives us a reason to rebuild.